Hey everybody, we're here at the 2022 CrossFit Games. I'm Mike Giardina from CrossFit Health. I'm super happy to have Nicole Aucoin here from Healthy Steps Nutrition with us. We just finished a panel on bridging the gap between fitness and healthcare. And what I want to do now is just continue that conversation. And it's really cool to have Nicole here because she wears a lot of hats within the CrossFit community. So when we ask her how we can really close this gap between what's happening in the affiliate and what's happening in the clinic, she can answer it from so many different perspectives. So that's going to be my first question, Nicole. Once again, thank you so much for being here with us. And actually, before I ask that question, can you tell us a little bit about some of those hats that you wear and what you do in the CrossFit community?
Sure. So my first hat, I started as a clinical dietitian. So I went to school to be a registered dietitian and realized I was on the opposite side of healthcare that I really wanted to be on. I was on the sick care side. I wasn't really helping people make meaningful change. That's when I started Healthy Steps Nutrition, and we ended up opening up a CrossFit gym. So we help people in our local community, and then we also help hundreds of other gym owners implement nutrition coaching programs. So we've done some things at our facilities, but there's a lot of gyms that have done really cool things in their communities to bridge that gap between fitness and healthcare.
Awesome. Well, let's start with that. Let's start with in your communities and with your experience. How have you closed that gap? How have you gotten other healthcare professionals on board? Have you more clients within your company or within the affiliate? How have you been able to create this synergistic relationship between healthcare professionals and your affiliate and coaches?
Yeah, so I'll take it from two angles. The first one with the healthcare professionals, we have a network of like-minded professionals that we refer to and that refer clients to us. So they know that we can help them with nutrition, fitness, accountability, with behavior change. So they refer clients to us, and then we have people that maybe need to work with a mental health therapist, or maybe they have endocrinology issues, or pediatric GI. We have quite a few pediatric GIs locally that refer clients to us. So we have this network of people that we can refer to that we trust and that trust us. And then from our affiliate side, people come into our gym because they want to lose weight, they want to get in shape, they want to feel better, they want to set a better example for their kids. And when we sit down with them and really dig deep in asking them why they want to do that and what success looks like for them, every single time nutrition's a part of that conversation. So we can't out-exercise a bad diet. So if I can set someone up for success right from day one and guide them to an option to get started with nutrition, fitness, and accountability, then they're going to see better results, which is going to help them stay longer. And then they refer more people, and we're able to add a meaningful position for another dietitian or nutrition coach to help them.
That's awesome. Really cool. What are some of the biggest hurdles that you've been faced with? One, as a nutrition coaching company, and then two, as a affiliate owner. What are some of the biggest hurdles that you've had to overcome, and how did you overcome those hurdles when maybe dissolving some of the misconceptions of CrossFit or even diet, right? There's so much information out there. So
there are so many diets that people are overwhelmed because they don't know what's right for them. They look on Instagram and they see someone with a six-pack talking about nutrition, and they feel like they need to follow that super restrictive diet. And when you look at the research with nutrition, people try 7 to 8 diets before seeking a professional. So it's not uncommon that people come to you and they've already tried a lot of different things. And a lot of times people will give us a call. The way we onboard people is we do a free discovery call just to find out if it's a good fit for them and for us. I want to set up a relationship that's going to work for both sides. And a lot of times people ask us, can you give me macros or a meal plan? Are you going to tell me what to eat? And the truth is I don't want to tell people what to eat. I don't want to give them a piece of paper and then feel like they're only successful when they follow that piece of paper. I want to teach them fundamental skills on how to eat more whole foods, how to balance your plate, how sleep and stress impact their nutrition decisions. So many times when you hire a nutrition coach, they just focus only on the food that they're eating. But the truth is, if we're not looking at how someone manages stress and they're always going to the kitchen and we haven't dealt with how to manage stress properly, they're not going to see the best results, because every time they get stressed, they're going to go back to the foods. And the same thing goes with sleep, right? If we're not sleeping a quality amount of hours per night where our blood sugar is elevated, our cortisol levels are elevated, and that's going to impact the decisions people are making around food. And when we look at more of a holistic approach as a coaching program, as gym owners, as CrossFit trainers, you're going to be able to truly help your clients transform their health and their lives.
Yeah, that's really cool. It's really interesting, the sleep and stress thing too, right? Because not only does it affect eating behavior, but physiological response to food.
Yep.
So that's a really good point, and something that's probably overlooked, like you said, quite a bit. What are some other strategies? So you talked a little bit about your strategy. Have you seen other successful nutrition companies or affiliates and how they were able to bring healthcare professionals into their communities?
Yeah, there's quite a few. I actually went to Atlanta a couple weeks ago to capture some stories of some amazing gyms that have, done a really good job doing fitness, nutrition, accountability. And one of the gyms I dropped into, CrossFit Identity, their nutrition coach, CrossFit trainer, is also a physical therapist, and they have a physical therapy location, a business inside of the gym. So they refer people back and forth to the physical therapy and then the gym. They work really closely together. I ended up sitting down and talking with a nutrition coach there for some time, and she actually gave me a personal story of her husband who was diagnosed with cancer, and he worked with a physical therapist strictly. He had throat cancer and wasn't able to eat, and because of the physical therapist inside of the CrossFit gym, he was able to get back to CrossFit and start doing CrossFit and learn how to swallow again. So there's so many really cool stories like that are happening inside gyms with, bridging the gap between healthcare. So many times, one of the things that Dr. Rodriguez said in the panel was, we're sick care professionals. And it makes so much sense. Doctors have so much on their plate, and they don't have time to help people with nutrition and give them the support and accountability that truly people need. Because you can look up nutrition information online. Like, that's not the value of our coaching program. Our value is in the accountability and support we're providing our clients. Yeah. And if we can set up relationships with doctors who know that their clients need that, but they're not being able to fulfill that service, then what a better way to impact your community and truly transform their health and their lives.
Yeah, no, that's great. That's great. And we'll wrap it up with this because, and I think that's one of the things here, but we just sat through this 45-minute panel, and we had some great questions from the crowd, and we had some awesome responses from you and Amy and Dr. Rodrigo. So what are some of the biggest takeaways from that panel?
I think it could be overwhelming if you think about the chronic disease crisis that we have, especially here in the U.S. But what I would say to you is start small, having conversations with the people that already know, like, and trust your business. If you're a gym owner, I'm sure you have doctors or nurses that are a part of your community that already trust you. Why don't you have a conversation with them if you offer nutrition, fitness, accountability, and start just letting them know how you can help them. One of the people said that they have a conversation with a pediatrician next week, right? So great, have a pamphlet of how your nutrition coaching program and fitness coaching program works. Train the staff so that it's easy for people to refer to you. Maybe you invite them all to come do a workout so they can experience it, and then they can say, oh no, it's not like flipping tires or what you see at the CrossFit games. It's, hey, you don't have to be super in shape to do CrossFit. Like, they're there to help you, and it's scalable and it's fun because there's a group of people doing it. So I think, people could get overwhelmed because the idea is overwhelming, right? There's such a huge chronic disease problem, but just start small, start with conversations and build relationships. Because at the end of the day, like, we all got in this business, we dedicated our lives to helping people, and it starts with the relationships of, helping those people in your community that you already know.
Yeah, I loved your response on the panel on even just talking to the front desk employees at a clinic or whatever it might be, having them understand a little bit more about CrossFit or nutrition or whatever you're offering to their patients, and maybe even providing some type of pamphlet in there so that when you go there and you're going to your doctor who's your trusted authority, and then they're showing that they're promoting CrossFit as a way to improve health and avoid sickness. It just kind of breaks down some of those misconceptions and makes it more acceptable to people who aren't already in the CrossFit community.
One of the things that we do is virtual nutrition seminars, super low barrier, right? People just need to log in through Zoom, and after COVID, everyone knows what Zoom is now. So could you not partner with a doctor's office and do a virtual nutrition seminar and then share some of the stories about the people that have transformed their lives through your fitness program, through your nutrition program, and invite them to come in for a Saturday workout or come in for a free intro and just slowly build that relationship with them so that they do trust you and they want to work with you.
Yeah. No, that's awesome. Well, once again, thank you so much for being on the panel with us and doing this interview. And we'll be working together a lot more in the future. So as always, it's been a pleasure, and I can't wait to do it again.
Thank you.
Of course.